Of year can be especially hard for a lot of us for a number of reasons. Officials with the University of Memphis revealed to Action News 5 that students reach out for mental health help the most in October and November. Joining us now to talk about this trend is Dr. Linh Luu, Executive Director of Student Health and Counseling Services. Welcome. Good to see you.
Thank you so much for having me.
Loving the tiger blue, by the way. Go Tigers. Let's talk about this time of year. Why October and November? Why do you see more students?
I really do think that number one is that we have been seeing an increasing demand in mental health support from students over the last probably 4 to 5 years, particularly coming out from COVID. But particularly, the last few years, October, November, we see a significant increase. And I think partly is, midterm finals coming up. And we also see that towards the end of the year, holiday season can be so joyful for so many, but can be so hard for so many as well. And just like, many people, our students experience stress just like adults, and, in working professional, financial distress, worrying about school. A lot of our students graduating in December and worrying about the workforce.
Getting a job. That'll certainly put some worry in you. Why is mental health just as important as physical health?
That's a great question. And over the past probably decade or maybe even more, there has been a really well documented link between health and physical health and mental health, and we see that particularly for college students, the impact of mental health can really make or break a student's career and the level of enjoyment of a college career. And so, if a student experiences anxiety or depression, it can really cost them their academic achievement and impact their whole entire career, let alone, there are a lot of physical implication of mental health. We see a lot of psychosomatic symptoms. Students with anxiety often experience headaches and other type of illnesses as well.
And show up at the medical center seeking treatment for what they think is physical, but they're actually just under a great deal of stress. So what are the programs and services available at the U of M for these kids?
So really at the University of Memphis, we promote student well-being as the whole, and we wanted the student to be with us as a whole person and showing up healthy, not only physically but also mentally and financially and among other areas of wellness. We approach mental health from a public health approach, meaning that we provide a lot of programming. Obviously from the counseling center standpoint, we do a lot of intervention services, therapy appointments. We have been seeing a lot of increase in demands in individual and group and couples therapy and family therapy, but also...
Did the election cause any of these students to have more stress than usual?
So, yes and no, right? I think that as a university as a whole, we provide a very strong support for students even before the election to talk about how to have respectful conversations, how to respectfully disagree with people, how to have conversation in classroom, out of classroom, how to manage stress, how to disengage from social media, how to protect themselves, how to know when is the threshold of their stress to be able to take care of themselves, when to reach out, when to reach in. And so we have done a lot of that months before the election.
Smart that you mentioned social media, staying off of social media being important to get your mental health back to where it needs to be, in the safe space, in the good space. Final 15 seconds, where should students reach out to if they need help?
If students need help, please reach out to Student Health and Counseling Services. We are located at 214 Water Tower on the main campus, and also we have been providing virtual services as well. So please visit our website, visit the University of Memphis website, or ask any of the University of Memphis employee. Many of our students also very aware of our services. We're here to help.
Dr. Linh Luu, very nice. Thank you for joining us today.
Thank
we
you.
appreciate it. All right, have a good semester. Thank you, ma'am. All right, let's turn things back over to meteorologist Eric Brill and Kim on the news desk.